So much has changed over the last few years with cannabis. It's got such widespread political, social, and medical acceptance now. Cannabis went from being a recreational drug to an operational drug.
Why do we need to be asking our patients about their marijuana usage?
The use of cannabis is more extensive than we might think.
Could you highlight a couple of things that cannabis can impact once the patient's in the chair and that treatment's begun?
Cannabis can increase blood pressure and increase pulse. If you use cannabis along with other drugs, you're still increasing the risk of pathologies, leukemia, erythroplakia, leukoplakia, hyperkeratosis. These are all morphologic changes to the tissue that could lead to something more not so great down the line.
So by use of cannabis, is there a certain time frame that it kind of gets out of the body?
No one has an answer to it. The greatest fear I have is that
Dental assistants are often the key to a patient accepting treatment or not. You're a key part of the patient journey, and so is CareCredit, a health and wellness credit card with flexible financing options so patients can pay over time for care they want or need, subject to credit approval. Want to know how to make sure CareCredit is a part of your practice's offerings? Email me at kevin@kevinspeaksdental.com and I'll make sure to help. That's kevin@kevinspeaksdental.com to make sure CareCredit is a part of your practice's offerings. Hey everybody, welcome back into another edition of the Dental Assistant Nation podcast. My name is Kevin Henry, founder of Dental Assistant Nation. So glad you've joined us and thankful to CareCredit for bringing us these episodes. Thrilled to welcome back somebody that dental assistants always ask me, when is this guy going to be back on the podcast? The answer is right now, and that is Tom Viola, dental's pharmacology expert. My friend, how are you?
Kevin, I'm doing fine, my friend. How are you doing today?
Hey, I'm good. I'm better because you're back on the podcast. Like I said, dental assistants, they love to hear from you, man. I pop into your courses all the time and it's packed house, and you've always got the good information, and I know you've got it for today for our audience.
Thank you, my friend. Let me tell you, a couple of years ago, I started teaching pharmacology to dental assistants at one of the schools where I teach hygienists as well. It's been a real learning experience for me, knowing how dental assistants interact with the rest of the team. And as I've said many times, the dental assistant really is the front and back door to the office. They're the first face that greets the patient clinically, and then the last face the patient sees on their way out the door. And so they really make an impression on the patient. And I'll tell you, I've had patients who've told me that they visit dental offices because sometimes they really have that bond with the dental assistant. They look for them. They want to know they're working that day. So it's taught me a lot about dental assistants and how they matter and what they do that matters so much to a dental team.
Couldn't argue, my friend. Absolutely. Well, we know one of the things that they do that matters so much is that health history form. Sometimes they got to ask the tough questions. And sometimes one of those is about what is going on with the dental patient. And my friend, sometimes that includes, are you currently using any kind of cannabis, any kind of marijuana in your personal life? Why is that question important, Tom? I'm curious. Why do we need to be asking our patients about their marijuana usage?
You and I talked about this years ago. I don't know how many, and so much has changed over the last few years with cannabis. It's got such widespread political, social, and medical acceptance now. Cannabis went from being a recreational drug, in my opinion, to an operational drug. A drug that you use not just to recreate, but to actually operate, to cope with your everyday, busy, trying life, And so I think that's one thing we have to realize is that the use of cannabis is more extensive than we might think. And it's not always about, man, this patient just reeks of cannabis smoke. It turns out that a lot of people use cannabis much more discreetly than you might think. So yes, of course, people still smoke cannabis and vape cannabis, but a lot of people these days, in the advent of extractions, are using, patches. They're using inhalers, like albuterol inhalers. They're using, topicals, creams, ointments, balms. They're even using suppositories, both rectal and vaginal suppositories. And so you have no idea patients using cannabis, if they're using cannabis, even if it's your coworker.
And I think the stigma has gone away quite a bit. And I think that's one thing that came out of COVID is the stigma went away a lot.
Sure.
So do you think that there's still that issue with asking patients on the health history about their intake of marijuana? Is there still that stigma there, in your opinion?
As a matter of fact, I think you're right. I don't think it's as much as it was a couple of years ago. I think it's almost acceptable now to use cannabis. I see a tipping point coming in, I would say not the very near, but near future, where it's almost going to be 50-50 between people who don't use cannabis and people who've tried it occasionally or people who do use cannabis. And I only see that increasing so that the ratio of people who use cannabis to people who don't use cannabis is going to increase. But a couple of points that really do matter to the dental assistant. And number one is going back to that, wow, this person really has that characteristic odor. Careful with that because not everybody who has that odor about them actually uses cannabis. Some of them may live with someone that uses cannabis, may drive with someone that uses cannabis. And so they have it on their clothing or on their person, but they're not the actual user. And so to your point, Kevin, we've got to be very non-judgmental, non-confrontational. It's got to sort of just be, so tell me about, your use of substances. Do you use substances? What do you use? And even say, look, no judgment. I just need to write it down because it's going to impact, your treatment today potentially. So we just need to know. But, we're all about live and let live here. We just want to know so that we have everything we need in our files. Now, what's important there for everyone in the dental office, not just the assistant, is when the patient says whatever they say, like, no, I don't use cannabis, or yes, I do, that we fully document that in a chart, right? So patient denies the use of cannabis. Patient admits to the use of cannabis. So that for posterity, for years to come, when someone look at that chart, let's say litigation develops years down the road, you can look back at that chart from years ago and say, well, got it right here. But if you didn't write down what their response was, we're not even sure you asked.
Absolutely. And we know everybody's job in the practice is to help protect the dentist's license. It's a key part. And like you said, documentation is such an important part of that. But I want to go back to something you just said a minute ago and about the impact that the cannabis can have on treatment. Could you highlight a couple of things that maybe we know that cannabis can impact once the patient's in the chair and that treatment's begun, just so that our dental assistants understand the connection between cannabis usage and what could happen in the chair?
Yeah, so important to know this because some of it is so counterintuitive. So, for example, one thing about cannabis use is that cannabis can increase blood pressure and increase pulse. Many people don't know that because rightfully so, they think about cannabis as something that mellows you out. So why would they think that that raises blood pressure and pulse? But it does,
Yeah.
certainly. And it also causes immunosuppression. If you think about the environment we work in dentistry, as I like to say sometimes in my live presentations, dentistry is in parallel to, let's say, an orthopedic surgeon that's doing, knee replacements with patients standing waist deep in swamp water. It's kind of like you're inflicting a wound inside a medium that's teeming with bugs. So it's almost unbelievable to think patients don't get infections after they get dental treatment. Well, it's because they have a functioning immune system. But patients who are taking and using cannabis don't always have that high level of immunity. Beyond that, if we just focus on the oral cavity, cannabis use promotes a poor quality of oral health. Brushing and flossing aren't high on your list. You're craving carcinogenic foods and drinks, right? And so xerostomia is often likely with certain forms of cannabis. So that just sets up the mouth for, not good things to happen. If you use cannabis along with other drugs like nicotine, smoking, let's say, or even alcohol, or even not, you're still increasing the risk of pathologies, leukemia, ritoplakia, leukoplakia, hyperkeratosis. These are all morphologic changes to the tissue that could lead to something more not so great down the line. And even if you're already, let's say, infected with HPV, well, that can increase your risk of head and neck cancer. Immunosuppression in and of itself increases your risk of cancer. So all of that tied together means, who are the experts in oral pathology? We are. Who are the experts in oral health? We are. Who are the experts in identifying head and neck cancer? We are. So all of that, plus the fact, again, we talk about the hypertension, right? And we talk about the fact that patients who use cannabis are sometimes difficult to anesthetize. If you let that statement just hang there, you go down a very dark road, which is, okay, this patient uses cannabis, so they're difficult to anesthetize. So I'm going to use more anesthesia and more epinephrine to make sure that that is profound anesthesia because this patient's resistant. And then you realize, wait a minute, I just said I'm going to give more anesthesia and more epinephrine to a patient who, by their very use of cannabis, is already hypertensive and tachycardic. Why would I do that? So it's a very slippery slope to walk down. And ultimately, that I think is the problem clinically. And then there are ethical considerations as well.
So by use of cannabis, is there a certain time frame that it kind of gets out of the body? Is it 24, 48 hours? Is there something that we should be more concerned in the dental practice and those dental assistants should really be on guard more than others?
Such a great question, Kevin, because no one has an answer to it. That's the
Ugh,
greatest fear I have is that we latch onto a number and we hold on to it. But with all due respect, we don't have any guidance from the dental associations on this or even the medical associations on this as to what's a suitable time frame for abstinence after which you could perform basically what we do is minor surgeries. And so we don't have any real guidelines on that. So everyone picks 24 hours as the magical number, but heck, that's like saying, everybody retires at 65. It's a
sure.
number we made up, right? No one really knows what the actual number is. And so I think what we have to do is to prepare ourselves both clinically and ethically and legally. We need to come up with a number that works for us in our practice, whatever that number is. You have to have abstained for 24 hours, 48 hours, whatever it is. You pick the number and then hold to that standard. Apply that policy to everyone, not just the patients, but employees too. So
There,
you
good point.
can't have worked in this office, and if you've not abstained for the last 24 to 48 hours, you can't be seen in this practice as a patient if you have not abstained for the last 24 to 48 hours. You get to pick the number, but at the end of the day, it's got to work for you. It's got to work for your patients, and ultimately, you can't make any exceptions because once you make an exception, that starts the problems.
So that's something we need to communicate then from the dental practice is if you've used cannabis in the last 24 hours, we can't see you today, correct?
Right.
Or 48 or whatever the number is.
Exactly. But okay, now here's the problem. I feel for people who are listening to this podcast right now saying exactly what I'm going to say next. Yeah, but Tom, you just said that most people have started to use cannabis very discreetly. So
Right.
how do I know they've used cannabis?
Right.
And you don't. That's why, to your point, you asked the question, do you use cannabis? And also keep in mind that what gets to be somewhat confusing is when patients say, I use cannabis, what does that actually mean? So, for example, someone could say, I use cannabis, but what they really meant was that morning they took an edible. Later on in the afternoon, they felt a little bit of a mid afternoon slump, so they smoked a little sativa, right? And then at night, they felt like they went too heavy on the sativa, so they vaped a little indica. Okay, well, they use cannabis. They use cannabis three different ways, and they use three different forms of cannabis. And the greatest misconception about cannabis is that it's a drug that's standardized. But really, when you use cannabis, you're getting, every time you use it, a potpourri of over 100 different cannabinoids. Like taking two decks of cards and throwing them in the air and grabbing, a handful, you're never going to get the same assortment twice. If you say to yourself, well, that's no way to dose myself with medication, realize from their perspective, that's the allure. Like, hey, I never know what I'm going to get, so let me try it again. And so that's what we deal with cannabis.
So true or false question coming here, okay? And
Yeah.
again, you're the expert, so I'm asking you. For so long, I have heard smoking is bad for you, but smoking marijuana isn't as bad for you in terms of tobacco's bad, but marijuana is better for you. True or false?
Gonna have to say false to that, my friend. And the
Okay.
reason for that is because, tobacco, for all of what people might consider to be the negative consequences, was somewhat standardized. And with regulations over the years, we've really identified what components are in tobacco smoke. They may not be great for us, but we've identified at least what they are. With cannabis, because it's not standardized, because it's not regulated in any way, because it could be grown in any sorts of conditions, virtually anywhere from traditional groweries to what people now refer to as grow houses, which is like the 2020 equivalent of meth houses from 20 years ago. But people move in, grow a whole bunch of cannabis all at once, move out and leave a toxic sludge behind them. You don't know what conditions that cannabis was grown in. You don't know if there were toxic metals in the soil, PCBs in the soil, heavy metals, whatever was in that soil, whatever that little plant was exposed to in its lifetime, pesticides, fungicides, insecticides, whatever, is all in that plant now, which is in that oil or whatever extract you're using. So if you vape that or you smoke the plant material, you're putting all that stuff in your body. But to your point, the answer is false because really, I don't know what's in the smoke. I don't know what's in the vape. So I've got to say in my mind, I'm thinking it's probably more dangerous because of the fact that it could be more poisons and toxins than I would ever get in, let's say, traditional tobacco smoke.
Lot to unpack here and a lot for dental assistants and really the entire dental team to really think about. And Tom, I know you are such a wealth of knowledge whenever it comes to things like this. So we don't have time in this podcast to go so deep, but where can they get in touch with you? Where can they learn more? I know you, like I said, such a wealth of knowledge on things like this.
Yeah, I'm gonna give you my website as the place to go to and everybody to go to. It's thomasviola.com. Anywhere on social media at Thomas Viola RPH. I've changed my handle from pharmacology declassified because I just feel like I'm trying to steer my career in a way that I can appeal to more than just dental professionals, but everyone out there, including the lay public. And I think you and I, Kevin, may be doing a lot more podcasts in the future, sort of
Yeah.
get it to a greater audience. But I hope the dental assistants that are listening know that can only mean good things. The more we educate the patients and the public on, what matters in dentistry, the easier it's going to be for us all the way around.
Yeah, and like Tom just said, I'm excited because Tom's committed some of his time to come back on this podcast more regularly. And I know, again, dental assistants have been asking me time and time again, when can we have him back on? And good news is moving forward, that's going to be more often. So good stuff coming from Tom Viola ahead. And hey, if you're watching this on drbicuspid.com or on our YouTube channel at Dental Assistant Nation, it is all in the show notes. So really easy for you to find. Tom, my friend, always good to hear from you. And thank you so much for your knowledge and your expertise. I appreciate it.
Always a pleasure, my friend. Looking forward to working with you soon. And take care, everybody. Thank you so much.
Absolutely. Looking forward to great things ahead. Thanks to all of you for listening to this episode of the Dental System Nation podcast. Some great things to think about. And hey, some great things to think about as you talk to the other people in your practice. That 24, 48-hour rule, is that something you need to think about for your practice? Some things to bring up maybe at the Monday morning huddle or your morning huddle. Some things to think about. Till next time, it's Kevin Henry, founder of Dental Assistant Nation and editor-in-chief for drbicuspid.com. Be sure you check that out. Signing off, and as always, wishing you nothing but success ahead.
Thanks, everyone.